got to protect your teeth because your smile is your first calling card. And so we want to make sure that your teeth are beautiful, that they are fabulous, because that's what you deserve. Today we are joined by two amazing Chicago-based experts. We have Dr. Kyra Barnes and Dr. Kenya McCalebb.
Hi.
And they're going to talk to you about cosmetic dentistry, talk to you about some of the yucky things that might be lurking in the back of your mouth that you probably don't want to talk about, but we should.
Absolutely.
And just get you prepared to just face the world with some beautiful teeth. So I want to thank you, ladies, for joining me today.
Thank you. It's absolutely a pleasure to be a part of blackdoctors.org Facebook Live.
Yes,
program.
yes.
So we are looking forward to providing some exciting information to your viewing audience.
Yes, because you guys out there watching, you need to know that Cardi B is not the only one who can get a bag and fix her teeth.
That's right.
You too can have an amazing smile. So I want to just start off and talk about this philosophy that you have, this practice that you have that focuses on life-enhancing dentistry. What does that mean, life-enhancing dentistry?
Life-enhancing dentistry is the kind of dentistry that creates positive changes to your teeth, to your smile, to your self-image, and to the impression that others have upon you. It is, as we well know, you only get one chance to make a good first impression.
Absolutely.
So like facial aesthetics, it's a form of facial aesthetics like dermatology, like plastics, that enhances the way we feel about each other. It's dentistry done, whether it's dentistry that you need to have done or you want to have done, it's done right and it's done beautifully.
Yes, and is that kind of the same as cosmetic dentistry when we talk about cosmetic dentistry?
It is, although we both are general restorative dentists,
Yes.
but everything we do has to be beautiful.
Right.
So, yes, it is cosmetic dentistry.
I think when your smile is on point,
Yes.
it just makes everything else come together more beautifully, and you just feel good and amazing about yourself.
Yeah.
And you can put your best foot forward once you have that beautiful smile.
You know, they say that they've done research, and research has proven that your smile has a very important social impact.
Yes.
In the dating world, an unattractive smile makes you less appealing. In the business world, an unattractive smile impedes your chances to excel, to progress.
Absolutely.
So those dental phobics, which we try to help them overcome, but dental phobics have no idea the power behind a beautiful smile.
And it is powerful, you know, it's a confidence booster, you
Definitely.
know. You know, once you have your smile right, you know, everything else will just fall into place.
Because when we go back to that whole life-enhancing piece, you know, some people, they might be afraid to speak up in a meeting if they're at work, or afraid to just, you know, talk to strangers, or afraid to get close to someone if they're dating. So it really can affect every area of your life. What are some of the treatments? So when we talk about cosmetic dentistry, what are some of the most common treatments that you specialize in?
Well, everybody knows about teeth whitening. Cosmetic dentistry involves several protocols, techniques, ceramic materials, expertise knowledge of not only the dentist but an expert laboratory technician to do things like close gaps between your teeth, repair missing, chipped or broken teeth, decayed teeth. Cosmetic dentistry straightens teeth, or gives your teeth even the appearance of being straight. You heard me mention earlier that about facial aesthetics. Cosmetic dentistry also uses Botox, believe it or not.
I did not know you could use Botox,
To eliminate the gummy smile, or to reduce your gummy smile. There's also an area in periodontics, periodontal surgery, that uses cosmetic dentistry to eliminate the dark spots in your gums, or to give your teeth a longer looking appearance or even a shorter looking appearance. So there are many things done under the category of cosmetic dentistry.
And I know one of the things that's really popular, people often want to know about teeth whitening. And so, of course, you have the things that you can do over the counter. You can go right to the drugstore, pick up something. What's the difference between the at-home products and then what you all would do in an office setting?
Right. So you can buy your Crest whitening strips over the counter, and then we do chairside whitening at our office, which is an hour session. So we break that session up into a 20-minute session in increments, and we do the proper isolation. We protect the gum tissues. We use a bleaching material with hydrogen peroxide, and it's activated by a light. And then afterwards, we would do a fluoride treatment to decrease any type of sensitivity. The over-the-counter products, they're useful. They're useful for bleaching your front teeth, but sometimes they move around for the whitening strips.
Yeah, because you got to like keep them on. Right. They slide. Yeah.
If you come and get a professional chairside whitening, we do custom-made trays that can fit your teeth properly so that the bleaching material can adhere better on the surfaces of the teeth.
And how long does that last, like compared to what you would just buy?
So typically, you want to do it maybe once a year. We have touch-up materials that you can use in between time if you want to maintain a brighter, whiter smile.
Also, it depends on your oral habits.
Absolutely.
Do you drink wine?
Right.
Do you drink coffees? Tinted colas. That can impact how long the whitening will last.
Absolutely. Anything that could stain a white shirt, you want to be mindful of it in the amounts that you're intaking, especially after you just completed a professional whitening.
And I don't think people think of it that way like we should, but it's like, okay, if something is staining your clothing, imagine what it's doing to your teeth and your body.
Yeah.
Which brings us to that whole teeth, oral health, and body connection. Recently, we did a Facebook Live just talking about diabetes and your oral health. So can you talk a little bit about, why it's so important to take care of your teeth when it comes to your whole body functioning?
Absolutely. Just yesterday, I had a patient in our chair who was a little frustrated because we asked her to fill out a medical history and to give us a list of a long, extensive list of the medication she was taking. What she didn't realize is that your mouth is not only a part of your body, but it's a gateway to the rest of your body. The research recently has shown a very strong link between the health of your gums and your teeth and the overall health of your body. Periodontal disease, which is a disease that's very common, it affects 3 out of 4 adults in the United States. It's a silent disease sometimes. And what happens is the bacteria and the inflammatory byproducts of that bacteria accumulate in your saliva, it accumulates in your the gums, and it travels through your bloodstream and affects distant tissues and organs and wreaks havoc. In the pulmonary system, it can cause pneumonia, pulmonary inflammation, infections. In the cardiovascular system, it can put you at risk for a heart attack, stroke, cause atherosclerosis. And there's a symbiotic relationship between diabetes and periodontal disease because, as we know, periodontal disease is an infection, and infections upset the regulation of the body's blood sugar. So it makes a diabetic patient worse. And in turn, a diabetic patient will be harder to heal. So the tissues in the mouth don't heal as quickly. So it makes periodontal disease exacerbate.
So this is just really one more reason. Like, of course, we know we need to see our general physicians at least, once a year, if not twice, but also to see your dentist because you guys can notice some things that maybe, the general physician didn't see.
Absolutely. I think it's so important and critical for patients to know as well that you just don't want to put things in compartments and separate, oh, this is my mouth and this is my body. I think that we need to be more mindful to know that everything is connected and that your mouth is just as important as your whole entire body.
More and more physicians are becoming more aware of the impact that dentistry has. So they do oral inspections. They make recommendations that, like, they require their patients to have annual checkups. They recommend that their patients come to the dentist to have routine checkups as well. Prevention is key. When we are able to see, we're able to treat.
Absolutely.
And one of the things that as dentists you guys can really help with is that early detection of oral cancer.
Absolutely.
Oral cancer, HPV. Can you talk a little bit about why it's so important to have the dentist take a look at what's happening in the back of your mouth, the throat, all of that?
Sure. HPV, as we well know, is one of the leading sexually transmitted diseases here in the United States. And it's a public health concern, which is why they suggest vaccinations. It's also an increasing public health concern as far as the oral manifestations of this HPV virus. This virus, this infection, has recently been associated with oral carcinomas, particularly HPV-associated squamous cell carcinoma. It affects the tongue, it affects the tonsils, the base of the tongue, it affects your throat. And it can be silent and then it can manifest. We have some photos. Is it possible?
Yeah, I think we do have the photo, the throat photo.
So we
Because of
can
course we want you guys to see.
Which is so very important.
Okay, and when they're able to pull it up, we'll show you these photos. But what I want the audience to know is that sometimes it's associated with shame, and it should not be. And the reason for that is, well, the actor Michael Douglas brought the spotlight when he had oral cancer to the fact that the HPV virus may have been associated with oral sexual behaviors. Well, that's what research has shown.
Oh yeah, we've got the photo behind us. So yeah, this was before. This is the before picture, right?
Absolutely.
Right.
And HPV is thought to, according to research, have a certain demographic. It's thought to affect males over females, 3-to-1. It's thought to affect white males, particularly non-smoking, ages 35 to 55. But trust me, in my practice, we've already identified 2, most recently within the last year. That infection, that HPV virus, does not discriminate. Behind us is an image of a patient who came to us for the first time on a routine examination. No symptoms, but he had a swelling on one side of his face, as you can see, that looked like it was tonsillitis. And he ignored it. And when I saw it, I alerted him and referred him. And it turned out that it was cancer. And he elected to not treat it. And I think it's the fear of, or maybe the shame. I'm not really sure why he elected. We saw him a year later. And there's another illustration that'll show how it progressed over the year. What I want to emphasize is that the HPV virus is extremely treatable when it's associated with oral squamous cell carcinoma. It can be treated with a very favorable prognosis for survival.
So this is the 1 year.
This is 1 year later. You can see that that's the before. And then there's an image that will show how the disease progressed. I asked him if he could swallow, and did his foods irritate him? And actually it didn't, so that kind of attests to the fact that it's easy to ignore it. That shows that it's, well, that was actually another image of the first year.
There's another image.
There it is.
That's one back.
It's okay.
Yes.
Okay.
There we
right
go.
there.
Okay, so you can see how the tissue is torn. It's pretty graphic, I know, but it's very important to see the dentist regularly, not only to have your teeth and your gums examined and treated, But oral cancer screenings are critically important. We look at the tongue, we look at the tissues in the mouth, we look at your head and neck, your throat. We look at every area, including your teeth and your gums.
So I think the take home is probably don't just rely on, oh, my teeth aren't hurting, they feel fine, they look fine, but really have that 6-month checkup, you know, twice a year, just to get that deeper evaluation.
Absolutely, yeah. Absolutely.
I want to see, I think I had one more question. So a lot of, on our site, we cover a lot of things like the oil pulling and the charcoal toothpaste. So a lot of the things that are popular right now, people are looking for kind of alternative, more holistic things. What are your thoughts on practices like oil pulling or using a charcoal toothpaste?
Right. I think this day and age, a lot of people are looking for a more natural way to treat things, and we're looking for things not toxic to put into our bodies. But I think it's very important that we do stay mindful of these home remedies as well, because they can be harmful. So oil pulling is basically a technique that is used in other countries, such as Asia. And what it is you take a sesame oil or
maybe like a coconut
oil, and you gargle for 30 minutes, and then you swish it around your mouth, and then you spit it out. And this is supposed to cleanse the mouth of all the bacteria and toxins that reside in the mouth. There's no sound scientific research that proves that this works and that it replaces a dental normal routine for hygiene in terms of coming to the dentist, brushing your teeth, flossing your teeth. It does not replace that at all. There's no sound research that supports that oil pulling actually can replace brushing or flossing your teeth. So if you are going to do oil pulling, you should be very mindful that it could be harmful as well. It can upset your stomach, it can cause vomiting, and it can make you very nauseous as well. You should see your dentist regularly, every 6 months, every 4 months for some patients, depending on the treatment and the patient. And you should be brushing and flossing in between your teeth to remove plaque or any type of bacteria that resides around the gum line and in between your teeth.
What about the charcoal toothpaste? So
the charcoal toothpaste is another holistic approach. It can also be harmful. There's no sound, again, evidence saying that this abrasive charcoal can whiten your teeth, because that's what it's said to do as a whitener. But in fact, it can be very harmful to the gum tissues and your enamel. So there's no strong, again, scientific evidence that supports that, oh, you know, this can replace whitening of your teeth, or this is good for you. But in fact, that it can be very harmful.
And then what about, there's a lot of debate back and forth about the use of fluoride. So of course you see fluoride-free toothpaste.
Right.
What are the expert
the recommendations?
Yeah, what's the recommendations for fluoride
Absolutely.
use?
So fluoride is safe to use. You can find it commonly in most toothpastes over the counter and mouth rinses. It is ADA proven if you use it in safe amounts that it is effective. You know, it's needed as a preventative measure to prevent some tooth decay from happening, to keep the mouth healthy. So it is a safe thing to use. You shouldn't shy away from it. You can also find fluoride in your drinking water and certain foods. So it's a pretty safe thing to use.
Well, I want to see if our viewers have any questions. And I guess while we're going through your questions, we also have some other images that we can show, just some examples of the different types of cosmetic work. Cosmetic.
They're coming up right now.
Okay, here they are.
Okay. First question is, why do we have bleeding gums constantly, or continuously?
Well, bleeding gums may be a sign of gum disease. I also need to point out as well, just as you mentioned, Sandria, the oral systemic connection. Sometimes bleeding gums may be a sign of something going on in your distant organs or tissues. So it's important to see the dentist. Most commonly, it's because of periodontal disease, because the bacteria and its byproducts causes the gums to be inflamed. Blood vessels within the gums become very fragile, and then they bleed. But it's real important to see the dentist, find out what the source of it is, and have it treated.
Yeah, if you're seeing blood, like that's not, you know, normal. Like you want to go get that checked out. Yeah.
Gotcha. So Lonnie says, my teeth are yellow. Please help.
Yellowing of the teeth.
What was the name? Zalani?
Zalani.
Okay, so, you know, the best thing for you to do would be schedule an appointment so we can evaluate why you have this yellowing of your teeth. We did mention whitening today, but sometimes you get internal staining of the teeth and external staining of the teeth, and sometimes a whitener just won't help. So it's very important that you schedule an appointment if you don't have a dentist with BWDA, and we can evaluate your case further.
A lot of times it may not be able to be treated with teeth whitening, but that's where cosmetic dentistry continues to produce.
Yep.
We can mask the stain
Absolutely.
with bonding or porcelain veneers, so we have a lot of treatment options to make your smile beautiful.
Do teeth yellow just naturally over time with age, or do some people, you know, they just have these naturally bright white smiles all the time, or should we expect some yellowing as we age?
Yeah, as we age, you know, your teeth, you know, they go through stages. They do change in color. Your teeth at 75 are not going to look the same as when you were 16 or 17. You know,
Okay.
so, you know, it's a part of aging, you know. But, again, cosmetic dentistry, if you're, you know, concerned about the way that your teeth look or the shape of them or the color of them, cosmetic dentistry is a very, very good option.
Absolutely.
Piper says, I need a dentist who does not push implants. What should she do?
Hi, Piper. There are a lot of other treatment options, but I do need you to know that dental implants are the standard of care.
Yes.
It is the best because it preserves bone, and you don't have to put stress or even remove existing teeth in order to support a bridge to replace a missing tooth or to support a partial. But we do, in dentistry, offer lots of treatment options if you are not interested.
So she should probably seek out a second opinion, see a different dentist, but understand that the implants are kind of the
Standard.
industry standard.
It is the industry standard, but there are other alternatives.
Absolutely.
Gotcha. Marilyn says, hi ladies, I have been suffering from teeth breaking. I have had cancer, had chemo, 9 mine are breaking off. My nerves are damaged, and any slight touch like hitting hurts really bad. I want to go, but scared of having pain. Is there anything I can use to make sure I feel no pain at all?
Don't be afraid. That's the first thing. Marilyn, right? Marilyn, don't be afraid. It's important to come to the dentist, and I know probably you've had your share of healthcare experiences, but it will get worse, and so it's important to address those problems and make them better so that it doesn't cause any other problems to the rest of your body as well.
And then for your procedures, do you typically do like a local anesthesia, or are there times where, you know, the patient is, you know, sedated to sleep? Because I've had both. The sedation is quite nice because you just wake up, it's over, it's done.
We do local, and in our office we have also had a visiting dental anesthesiologist to come in and to do sedation, IV sedation. We provide in our office for patients who have some fear, nitrous oxide which is a form of conscious sedation. So we do have a lot of options to help relax and to ease your anxiety about seeing the dentist.
And our office is very spa-like too. I think that has a lot to do with it. You know, we generally care about our patients and the treatment that we're providing for our patients, and we try to make them as comfortable as possible, whether it's like soothing music to their ears or a neck pillow or a warm aromatherapy towel. Just everything, we just try to make sure that the patient is very comfortable.
That's awesome. That the aromatherapy towel. That's okay. I see y'all. My dentist didn't do that.
Precious Carter says, being a type 2 diabetic, I have noticed that my teeth are very sensitive and chip and break very easily. I use coconut oil and Colgate Total. What else can I do to strengthen my teeth?
So strengthening the teeth. What else can help?
Well, I have to emphasize, see your dentist.
Yes.
If you don't have a dentist, come and see us. But there are reasons, other than being diabetic, that can cause that to happen. It's just important. It's hard to answer. You just need to come in for an oral exam or go see your dentist for an oral exam.
Alyssa says, is deep cleaning really necessary?
Yeah. This is a case-by-case situation. I think a lot of times a lot of people get confused when it comes to a deep cleaning and a regular cleaning, because sometimes you don't need a deep cleaning and patients will come in and say, well, I want that deep cleaning, and it's like, no, you don't really need that. You know, the treatment doesn't call for that. So sometimes it's not necessary for you to have a deep cleaning. Now, if you have periodontal disease and loss of attachment of tissue from the tooth, then that's something completely different where a deep cleaning is needed. And again, I cannot stress that you stay on top of your appointments and schedule with your dentist regularly so you don't self-diagnose yourself or randomly look that stuff on the internet. You know, I do that too, but you know, not to read into things too much until you see a doctor so they can properly diagnose you.
And the reason why a deep cleaning may be necessary as well, to add on to Dr. McCaleb's response, is that with periodontal disease, you do lose the attachment, and it creates gum pockets. So food, bacteria, plaque can get deep below your gums, too deep for you to even reach with your toothbrush or your floss. So that's why it's important to come in and have them professionally cleaned, where we can get to the depths of your pockets in the cases of periodontal disease.
Joyce asks, what causes teeth to become buck?
What causes buck teeth?
You know, sometimes it starts at a young age. For kids, you want to make sure that when they get to a certain age that they're not still doing things such as sucking on their thumbs or biting on, you know, toys or putting things in their mouth that may make the teeth more protrusive in the future. A lot of time with kids, I like to talk to parents about, you know, the habits of the kids and, you know, are they, you know, sucking on their thumbs and, you know, their fingers or two fingers, and when they need to start, you know, intervening in that and saying no, you know, to the child. So that could be one reason why some teeth protrude out. I don't know if Dr. Barnes wants to add on to that it may start at an early age? Or?
Absolutely. Yeah. And sometimes it's skeletal. It might be a familial tendency. So orthodontics can help to correct that.
What do you think about whitening at home? What's your advice on that?
So the over-the-counter whiteners are good, but a professional whitening is even better. I think that the over-the-counter whitening strips are limited in terms of bleaching and whitening the teeth to just the front parts of your teeth, and they're not truly customized for individuals. So it's kind of just a general strip that kind of goes across your teeth that can move around. But if you have a chair-side or a professional whitening, you can have custom take-home trays and bleach at your leisure. So I would recommend a professional whitening over the counter.
And as you mentioned earlier, there's levels to this whitening. So what
so
you buy
many
at
levels.
home may only do, kind of the basics, but if you need more, there's other things that you can do.
Absolutely. There are certain percentages of the chemical, the hydrogen peroxide, that you can buy over the counter, and there are certain percentages of the chemical that we use in office with the light activation. So, I think the recommended treatment would be to have the professional chairside whitening.
Get an individual plan.
Yes.
And the professional whitening will bleach your teeth, whiten your teeth in a fraction of the time.
Absolutely.
What's your take on brushing the teeth with coconut oil, hydrogen peroxide, or baking soda?
There's a lot going on.
Like individually or all at once?
Coconut oil, hydrogen peroxide,
and baking soda.
Okay, so all three, I'm going to tell you right now, I'm just going to be very blunt. They can be very harmful to your gum tissues. If you're not big on the fluoride, maybe get a toothpaste. I wouldn't recommend it because I recommend using a toothpaste with fluoride in it. Just keep it simple. The hydrogen peroxide, the coconut oil, and the baking soda, it's too much going on. Just a regular over-the-counter toothpaste would work just fine.
And brush at least twice a day.
At least twice a day, please.
And floss.
And floss.
Absolutely.
Okay, you spoke on gargling. Some people are confused. Did you say they should gargle for 30 minutes?
Well, I was actually explaining the technique of oil pulling. So in the technique, the research that has been conducted, which is not strong research, it said to gargle for 30 minutes with the oil in your mouth and swish it around, and then spit the oil out, which will remove the toxins. But I'm not recommending that we do the oil pulling. That's not a technique that is proven to take the place of your oral hygiene in terms of brushing and flossing your teeth.
How do low-income people afford cosmetic dentists?
What's like a typical price point? Are most of the more common procedures, are some of them covered by insurance? Payment plans? Like what's kind of a beginner's entryway? So if you do have some things going on in your mouth, how can you start taking steps?
Cosmetic dentistry, like plastic surgery, like having your hair, nails done, are elective procedures. Those are procedures that you want and not necessarily perceived by others as needing to have done. So the insurances usually do not cover them, unless it's associated with having to replace a decayed tooth or a tooth that chipped and exposed the nerves in the tooth. But you're absolutely right, Sandria. An entry level is to work with payment plans. In our office and in many other offices, there are different type of payment programs that allow you to extend a credit, so it can allow you to pay over time for the dental work that you have to have done.
What can you use to whiten bonded teeth after 20 years?
Bonded teeth.
Resins.
So you can't, unfortunately, whiten any types of ceramics, a resin veneer per se. You would have to get replacement of those restorations. There's just no other way of getting around that. You would just have to get those crowns or resin veneers replaced if you're trying to whiten, because the whitening material wouldn't necessarily whiten these types of materials.
Okay, last question. Eagle says, I brush my teeth after everything I eat, usually 5 to 6 times a day. I was told it was bad for my health. Any truth to that?
Can you overbrush?
He's well motivated.
Right.
Right.
And we love patients that are motivated and you know, a little OCD about their oral health, but brushing like the way that you're doing right now could be more harmful. It can be harmful in terms of brushing too hard and abrasive on your gum tissues. There's something called abfraction, where there's a scooping out of enamel from the gum line of your teeth, that if you overbrush and you're brushing vigorously, that could happen. So brushing twice a day or after, you know, your meals and your flossing should be just fine. 6 times a day, that's kind of overboard. But we love your motivation.
You know, the standard is brushing 3 times a day, actually, according to the American Dental Association, but at least twice a day. And use a soft bristle toothbrush that's less abrasive to your teeth.
Absolutely.
Okay.
Well, thank you, ladies, so much for all of this information. For the people who are watching from Chicago, please tell them where we can find your amazing office. They have an office of just amazing black women. I love it, the entire staff. So please tell them where they can find you.
Okay, we're on the south side of Chicago, 8245 South King Drive. Our telephone number is 773-873-7000. You can follow us on Facebook at Barnes Walton Dental, and then you can follow us on Instagram at BWDA_smiles.
Awesome. Well, thank you, Dr. Kyra Barnes.
Thank you.
Dr. Kenya McCalebb.
Thank you.
Thank you all for watching and for your amazing questions, and we will see you next time.
See ya.
Bye.
Bye.